At the beginning of your shift, you as a nurse got a phone call from a male client reporting about the exacerbation of his chronic lower back pain after working in the yard all weekend. The nurse knew that the worsened symptom came from an acute inflammation, which is the best non-pharmacological intervention should the nurse recommend to this client. Number 1, heating pad. Number 2, positioning for comfort. Number 3, rest from pain-aggravated activities. Number 4, stretching exercises. The correct answer is number 3. You must first stop using the muscle to avoid any more damages.